We're going to talk about the difference between hypermobility syndrome, which is everywhere in your body, versus a hypermobile joint. Hypermobility syndrome, which would be Ehlers-Danlos Syndrome, and type 3, which is the collagen everywhere in your body is affected. Your eyes, your gut tubing, your heart, connective tissue, all of it, not just the joints, not just your skin. A hypermobile joint would be, let's give an example of the knee. Your hip could not be moving very well, your ankle could not be moving very well, and then your knee has to move extra because those two things are locked up somehow, which causes pain in the knee. Now, typically somebody would go to a doctor and point to their knee and say, my knee hurts, figure this out, and the doctor is looking at the knee, maybe they're considering other joints, possibly not. So what often gets missed is that the hip range of motion is not looked at, or the ankle is locked up somehow. It could be from an old sprain, like from years ago. And those two things need to be restored and have their space renewed so that the knee can then stabilize and not have to move so much. So a hypermobile joint can be in a hip, it can be in a knee or a shoulder, and oftentimes you have to look at the joints around it that they're moving very well with good range of motion so that the hypermobile joint can lock itself up again and be normal.